Hello everyone, welcome back to my show, and I have now another amazing guest. You know, sleep apnea is so much on the rise, and I want to introduce Dr. Bryan Keropian. He's been a practicing dentist for almost over 30 years. Amazing, amazing experience. He's in Beverly Hills and has done so much research and innovation in sleep apnea, and people who also can't wear the devices for sleep apnea. Welcome to the show.
Well, thank you for having me. It's a pleasure to be here with you.
Absolutely. I want you to explain to the audience why, in an anti-aging and regenerative medicine show, where I want to bring the awareness, why I would even entertain or bring someone who to talk about sleep apnea. I've also had Dr. Naji on the show prior to this, but I find this topic so important because so many Americans are afflicted with this.
You are right on there. From my experience in working, sleep apnea is one of the most dangerous problems to the public on the planet. If you aren't getting enough oxygen when you sleep, your tongue rolls back, blocks the airway, and your airway is blocked 10, 20, 40, 60 times an hour.
Wow.
For 15 to 30 seconds a pop. Insufficient oxygen. How do you think that's going to affect your health? Not good. And listen, you're dealing with people who are taking care of their bodies and making sure they look better and they do better. This just stands
low oxygen environment in their body is not good.
Not good at all.
Please explain why. We were mentioning and we were discussing some interesting facts. 1931. Let's start with 1931.
Well, I thought you were going to start with the Civil War.
I should.
No, 1931. Absolutely amazing. A German Jewish physician in Hitler's Germany was awarded the Nobel Prize for research showing that low oxygen levels in the body lead to increased cancer, infection, virus. Now this was Nobel Prize, so this is good stuff.
How come we didn't know about this?
Well, very interesting question. Where has this been? But then in 1941, he had further research that showed that abundant amounts of oxygen led to reduction or elimination of all cancer, infection, and virus. Those are the two things. Not enough, you got problems. You have sufficient oxygen.
Some resolution of those issues.
Boy, resolution is a great word.
Yeah.
Where has this been? I'm a little irritated by it that it's been swept under the rug.
And that's really what a lot of, in terms of integrative alternative medicine, we're trying to make, again, the awareness became, and we understood the fact that when our body's in acidic state, it dissociates less oxygen.
Well, you are very right on. When you don't have enough oxygen, you become acidic.
Yeah.
Acidity is bad news, and acidity causes weakening of the bone. It inhibits the cells that grow new bone and encourages and propagates the cells that degrade bone. Well, all the seniors have osteoporosis. Wow, where's this been?
Yeah.
Not good. So between the low oxygen and the acidity, we have some real problems. Now, one of the problems is medicine does not have a methodology to treat this. Their methodology is something called the CPAP.
Yeah, the CPAP device where it's a
mask.
Right.
The mask that you sleep like this with a big mask.
And you put it at certain pressures, like you have to raise it to the pressure that they find that correlates best with the patient.
Yeah, well, sometimes it goes as high as sticking your head out of the car window at 20 miles an hour.
Yeah.
So not good.
No.
The rejection rate is 60 to 80% of the people who treat it. So medicine doesn't have a methodology.
Nobody likes wearing the device. And they've tried even with the nasal cannulas, those are the ones that you put in your nose, just all sorts of devices, and people don't like it.
We know that the CPAP is medicine's #1 treatment.
Right.
60 to 80% reject it.
Right.
So medicine has turned this over to dentistry and has made mouthpieces. One type of mouthpiece that seems to have gained a lot of popularity with the dental community pushes the jaw forward.
But doesn't that cause issues much later on?
You are, again, I keep on telling you, you're so right on. I'm impressed with your knowledge.
Thank you.
That's right. It causes pain in the temporomandibular joints, TMJ, muscle pain. The face starts to hurt. It even causes the bite to go off. I did not like that. So I developed my own. I developed a small mouthpiece, goes just on the top. The one for the jaw, pushes the jaw forward, is upper and lower.
Right.
It's a big horse.
Yep.
This is just the upper.
And again, a lot of the clients I know that got that device also would complain about that. Particularly, they said it would cause a pain in the temporomandibular joint. Yeah.
You got it. And we add a little bar and we add a little tail. Now, what does the MD do when you go in? He puts a little stick in and pushes down.
Yep.
And I
That's
know
called a
usually,
tongue depressor.
And that's right, the tongue depressor. And I know he gags a lot of people.
Yep.
But we put a little tongue depressor on there and we do it slow. It's comfortable. And what are we doing? We're pushing the tongue down because the tongue falls back and blocks the airway when we sleep, and we open the airway
throughout the whole night.
Incredible. We get. And
have you looked at like then the O2 like the oxygenation stuff with this guard on?
And I've compared it to everything out there, and we have done very, very well with this. We surpass those that open. So we've done well, and we've stopped so much pain.
And you don't get the misalignment either. All of the